So where I personally refer the most to plastic surgeons is for lacerations. And there's always that question in my mind, should I do it as a general pediatrician? Is this child better off seeing a plastic surgeon? Do you have any general advice for people when they should see a plastic surgeon?
I mean, I think that every little lump or bump doesn't really need a plastic surgeon, to be honest with you. I mean, I've gone to the ER, with one little stitch. I mean, did it really need it? It needed it because it was gaping open, but one stitch you're going to call a plastic surgeon for? But it is Los Angeles, and Los Angeles is a little bit different from other cities. So if it's crossing the Vermilion border, a lot of times that's when I get called. And so we want to really get that Vermilion border together nice and pretty. So Vermilion border, sometimes the pediatricians or the ear doctors are not very comfortable with ear lacerations. So if it's a difficult ear laceration or lip or difficult nose or a dog bite, I get called for lots of dog bites. And, that's when I think it's good to call a plastic surgeon. A difficult area or a dirty wound or a complex difficult dog bite, things like that.